Disclaimer: the following article is for informational purposes only and does not provide medical advice. Always consult a qualified healthcare professional before making changes to your medication or treatment plan. Blood pressure management should be tailored to individual health conditions under medical supervision. We repeat, under medical supervision. This article is for educational purposes only and does not replace professional medical advice. Do not discontinue any prescribed medications without consulting a qualified healthcare provider. Blood pressure medications. Understanding the risks and alternatives. Introduction. High blood pressure, hypertension, affects millions of people worldwide and is commonly treated with prescription medications. While these drugs are effective at lowering blood pressure, their long-term effects and potential risks are often overlooked. Many individuals experience side effects, and aggressively lowering blood pressure may sometimes lead to unintended health complications. This article examines the mechanisms, benefits, and risks of common blood pressure medications, along with alternative approaches to managing blood pressure through lifestyle and dietary changes. How blood pressure medications work. There are several classes of blood pressure medications, each targeting different physiological mechanisms. Diuretics, water pills. How they work: help the body eliminate excess sodium and water, reducing blood volume. Common examples: hydrochlorothiazide, furosemide, Lasix. Potential risks: electrolyte imbalances, low potassium/sodium, dehydration-related dizziness and fatigue, increased risk of gout. Beta blockers. How they work: slow the heart rate and reduce the force of contraction. Common examples: atenolol, metoprolol, propranolol. Potential risks: fatigue and depression, cold extremities due to reduced circulation, may worsen respiratory conditions like asthma. Calcium channel blockers. How they work: relax blood vessels and reduce the heart's workload. Common examples: amlodipine, verapamil, diltiazem. Potential risks: swelling in the legs and ankles, edema. Dizziness and low blood pressure symptoms, increased heart rate in some individuals. ACE inhibitors, angiotensin-converting enzyme inhibitors. How they work: prevent the body from producing angiotensin II, a hormone that narrows blood vessels. Common examples: lisinopril, enalapril, ramipril. Potential risks: persistent dry cough, higher risk of kidney dysfunction, possible link to increased lung cancer risk. ARBs, angiotensin II receptor blockers. How they work: block angiotensin II from binding to receptors, preventing blood vessel constriction. Common examples: losartan, valsartan, telmisartan. Potential risks: dizziness and fainting, potential for elevated potassium levels, hyperkalemia. May not be suitable for individuals with kidney disease. The risks of overly aggressive blood pressure control. While blood pressure medications can save lives, recent research questions whether aggressively lowering blood pressure is always beneficial. Increased fall risk. Blood pressure medications increase the risk of fainting and dizziness, particularly in older adults. A 2014 JAMA study found that elderly patients on multiple antihypertensive drugs had a higher risk of falls and fractures. Impaired kidney function. Some studies indicate that aggressively lowering blood pressure may increase the risk of acute kidney injury. A 2019 Hypertension Journal study found that patients with blood pressures below 130/80 millimeters of mercury had a higher mortality risk if they had pre-existing kidney disease. Cognitive decline and dementia risk. The brain requires adequate blood flow for cognitive function. Studies suggest that excessive blood pressure reduction in older adults may contribute to cognitive impairment and increased dementia risk. Alternatives to medication for blood pressure control. Many lifestyle modifications have been proven to help regulate blood pressure naturally without the side effects of pharmaceuticals. Dietary approaches. Increase potassium and magnesium intake. Found in leafy greens, bananas, nuts, and beans, these minerals help regulate blood vessel function, reduce processed salt, but not natural salt. Excessive refined salt may contribute to high blood pressure, but unprocessed sea salt contains essential trace minerals that support overall health. Adopt a whole food, plant-rich diet. The DASH diet and Mediterranean diet have been shown to significantly lower blood pressure. Exercise and movement. Engage in aerobic exercise. Walking, swimming, and cycling have been shown to lower blood pressure naturally. Strength training helps improve vascular flexibility and insulin sensitivity, supporting cardiovascular health. Mind-body practices, slow breathing and meditation, activates the parasympathetic nervous system, reducing stress-related blood pressure spikes. Acupuncture and herbal medicine. Some studies suggest that adaptogenic herbs, like ashwagandha, and acupuncture can help balance blood pressure levels. Monitor and personalize treatment. Regular blood pressure monitoring. Instead of relying solely on doctor visits, tracking daily variations can help detect patterns and assess whether medication adjustments are necessary. Tailored treatment plans. Medications should be individualized considering age, kidney function, and overall health rather than a one-size-fits-all approach. Conclusion: rethinking the one-size-fits-all approach. Blood pressure medications play an important role in preventing strokes and heart disease, but they are not without risks. The medical community continues to debate whether aggressively lowering blood pressure always leads to better health outcomes. Informed decision-making is key. Patients should work with their doctors to determine the best course of action based on their unique health status. Lifestyle modifications, including diet, exercise, and stress management, can provide powerful, natural solutions for long-term blood pressure control. Personalized care is essential. What works for one person may not work for another, and medication should always be carefully tailored to individual needs. Disclaimer: this article is for educational purposes only and does not replace professional medical advice. Do not discontinue any prescribed medications without consulting a qualified healthcare provider. The following article is for informational purposes only and does not provide medical advice. Always consult a qualified healthcare professional before making changes to your medication or treatment plan. Blood pressure management should be tailored to individual health conditions under medical supervision.